So I'll let you guys do a brief introduction of yourselves in a moment, but I'll just set it up briefly. The idea behind this was to talk to a couple of guys that are designing experiences during times such as this, volatile moments. So we've got an agency. We've got Patrick Givens, the VP, head of VaynerSmart, VaynerMedia. Really, really excited to have you along, Patrick. And we have Daniel Martz, who's the CEO for EQ Care, a Canadian company, and fellow Canadian. Great to have you on board. And they've been working together on creating some experiences for this time. So maybe the first thing we'll do is I'll let you guys introduce yourselves and sort of set up what you've been working on, and that'll help to guide our discussion. And also, I'll just mention, I do want to open this up to questions from the everyone else out there too. So if you've got a question as this goes along, then feel free to type it in and we'll moderate that. So Patrick, why don't I let you introduce yourself and go from there?
Sure. Thanks, Teri. Hi, everybody. I'm Patrick Givens, as you said, VP, head of VaynerSmart. So we are the emerging channels division of VaynerMedia. VaynerMedia, full service digital marketing agency. Some of you may be familiar with our founder and CEO, Gary Vaynerchuk. Gary and I have worked together now since 2016. Kind of carving out a number of different emerging channels for the agency, and voice is really first and foremost our biggest focus. And then we've been fortunate enough to get to partner with Daniel's team over at EQ Care really just over the last couple of weeks on some projects around trying to design for something to bring a little bit of value and hopefully help things out in this challenging moment.
Wonderful. And Daniel,
yes.
Tell us who you are.
Hi, everyone. So Daniel Martz, CEO of EQ Care, which is a Canadian virtual care provider focused on empathetic and compassionate care management solutions and care navigation. So more about directing patients to the right resources and practitioners, leveraging, using approaches that really focus on ensuring we provide the right tone and an element of mental health that surrounds each interaction that we have.
Wonderful. So to sort of set that up then, Daniel, with your company, what are you trying to achieve at this point? Like, what are the use cases? What are you building? And maybe how is that different during this time compared to other times?
Yes. So we're, in that vein of creating an experience that directs patients to the right practitioners, the right resources in the system, and in particular in times like these, the right information from the public health authorities on what is the best way to treat and manage symptoms associated with COVID-19. For us, it's about wrapping those interactions and experiences again in this frame of compassion and empathy, and having a calming effect associated with delivering information that, when delivered in the format of kind of sterile information updates, can be quite jarring, quite shocking, and in a lot of cases can compound the difficult effect that it has on the mental psyche of the population and the individual users of the technology. So in the mode of voice interaction, having that calming effect surrounding it, and also directing people to the right mental health resources. So in providing the guidelines and in providing the right up-to-the-minute information, also providing the resources that are available to help manage the stress and the elements that surround, essentially digesting this information. In terms of the way that the use case is different in times like these, it really comes down to the timing and the type of information. So in times like these, different regional and even local resources are being overwhelmed by the minute and by the hour, especially when demands on them are exponentially increasing. And there are different pockets of outbreaks that are happening, which overwhelm pockets of the system. And then new resources are available and made available by the public health authorities associated with these different regional differences. So having this model of care navigation with a surrounding empathetic and calming effect, it's important to really have that information updated by the minute, by the hour, and then also wrap through a methodology that new information with the element of calm and the element of delivery that can be digested in a way that's not shocking and, you know, essentially jarring localized populations into pandemonium and, you know, let's call it knee-jerk responses.
Yeah. And when I hear you speak about that, you know, naturally, you know, you talk about sort of empathy and compassion. Obviously, there's a big design component for that. So, Patrick, like, how do you deal with that? Or what are your priorities when it comes to designing these experiences?
Yeah, it's interesting to think of it. And actually, I was caught the end of Roger's talk right before this, and so many of the experiences he highlighted are great and do a really great job at what they are meant to do, which in a lot of those might have been entertain, or it might have been inform, but in a much more casual environment, like cooking recipes stuff, right? You want to get information out of it. It's a similar job to be done as we have here, but it's a totally different setting and a totally different context for the user coming in. So we try and start by really, again, designing out of a space of empathy. What are we building? How do we know who is talking to us and what they need quickly? So a couple of those design principles, I mean, first and foremost here, we're operating from a do no harm space. We want to ensure that what we're putting forth is clear, is accurate, is not in any way contributing to confusion, which are all things that perhaps if you get a little too cute with the experience, even inadvertently you might do. So that's a first and foremost gut check for us. Second, the idea of trying to inform without overwhelming and making that really careful. So in a lot of these cases, less is more. It's about whittling down. There's a lot of different value that a company like EQ Care could bring people, a lot of different information they could provide. It's incumbent on us to focus in, as you would in a real conversation, talking to an actual assistant in a moment. It's about triage in this instance. It's information coming in, or I'm sorry, questions coming in fast and furious, and we are trying to help people get the relevant information to the specific question in that moment as quickly as we can. And so that introduces a whole bunch of design principles about working through what are the decisioning criteria to match someone with the right information for them. It's a whole logic exercise for us of, so say in this instance, if we could ask someone, have you traveled to one of these given regions where there's been reported cases? Have you had X, Y, or Z other experience that would make you potentially at risk? Or also, are you actually experiencing symptoms today? Well, we could do that in there's design decisions all the way through how you progress through that. But fundamentally, we know if you are experiencing symptoms, that means you urgently need to be in contact with medical professionals. And so let's ask that question first and very quickly get you the answer that you need. If no to that, then what are the other clarifying points we can ask after it? And so really it's about, for us, it's limiting things to the bare essentials, trying to come through while retaining a nice empathetic tone throughout, but not overwhelming. And then I think Daniel hit on this too. It's timely and accurate. The information has to be correct. And that means planning up front in our design phase too, so that everything we are building, we're also building processes to keep it updated after the day we launch. This keeps going. Design doesn't stop when we're sitting there with a VUI flow in front of us. The design is also a process design to keep things going.
Right. You touched on a lot of information there. So what if somebody's interacting with a device or this experience, but they are escalating in terms of the severity, or there's some sort of crisis that a person's experiencing? How do you deal with that? Either one of you, or maybe both of you, can take a stab at that. Do you want to take that, Daniel, first?
Yeah, we gave you guys some fun topics to talk about today. I want to go back to Roger's one where we get to play with little kids.
Yes. So I think, I mean, as part of our, and Patrick can add more color around the approach, but as part of our kind of mission of compassionate and empathetic care, it really comes down to having specific protocols in place to deal with what are emergency scenarios. So, for example, we're a mental health focused group, and we have protocols associated with those who are coming in with acute mental health concerns and as serious as those who are contemplating suicide. So, we have these protocols built, and we have certain, training that's very serious that happens for our staff. So it's how do we convert that more human-based process into, an automated approach through voice that can help calm the person and use some of the approaches that were discussed in prior talks, certain music and certain language and certain tones of voice to calm that person at least to the period where they get accompanied until an emergency services professional is there with them or a family member is there to accompany them to where they need to be. So it's picking certain lanes on what is appropriate for a voice assistant to take care of to a point, and then quickly handing it off to the right individual, family member, practitioner, or emergency services professional. And it's critical to make those decisions, very carefully, and not take the experience, with the voice assistant too far in that framework.
Right. Patrick, anything to add? And just before you do, if anybody does have a question, please feel free to write it in there and we can add those into the discussion. But sorry, go ahead, Patrick.
Sure. Yeah, so I think just sort of building on where Daniel was going there, you heard from the EQ Care side, they have a expertise and background in what some of these modes of escalation. What are you looking for? What are triggers? What are things that they might train staff in other channels to recognize and how to handle? So an initial thing for us as we do get into the voice side with this specific experience is how do those translate into an automated setting, into something where we can account for some scenarios, but there are undoubtedly going to be some that we aren't ready for. So I think that was when we think about what is this the right domain for, what is voice going to be good for and what is it not, we want to use, and this will get slightly technical, but for anyone there who does any voice design work, we want to think about affordances, we want to think about what we would call technical side error handling, and then escalation, right? And so on the affordances side, where are things that aren't following directly to either a pre-described flow that we might have put together, or they aren't going according to plan necessarily, but they are quite close to the core experience we're trying to deliver. It's within the domain that makes sense here. And so those are experiences we know we need to account for. We need to keep them kind of on the rails of the experience as best we can. Then there's those where you get to, we would talk about in any experience, error handling. It's outside the bounds of what we intend to handle here. And then is our mode to try to route you back into the preferred experience, the kind of the thing we've designed, not only limited to a happy path, but something that's in keeping with the domain of what we are doing here? Or do we hit an escalation trigger instead? So if we get error handling, you could deal with affordances and working back then, or you could go error handling, okay, this is actually a trigger for escalation and we need to manage this, we need to potentially buy ourselves time, but give a kind of a jumping off point to a place where it is the appropriate domain to have this conversation. And these are all principles that we would have no matter what experience we're designing. This would be true if it was a trivia game or whatever thing you might be playing with, but the stakes are higher here. This is serious, and it'd be not just irresponsible, but unethical to put something out and offer and invite conversation around such an important and serious topic at a time like this and not be pretty seriously thinking through those escalation plans as well. So that's been candidly the majority of the conversation, discussion, and work between our team and the folks at EQ Care is learning from their expertise around handling these kind of conversations and bringing ours of how to translate that into a voice experience.
Wonderful. Well, this is great. I mean, this gets into so much of obviously the design of a voice application. There's so many concepts that need to be taken into account, as you guys have highlighted so well. So I love it, guys. For the sake of time, I think we're going to cut it there, but I really appreciate both of you taking some time. Can you maybe just quickly give us information on how people can otherwise connect with you if they want to learn more about what you're doing or contact you? Patrick, would be a good way.
Yeah, sure. I'm probably best on LinkedIn. You can find me at Patrick Givens. Also, though, on Twitter, PAT6414, across those two channels. But LinkedIn will probably be the best starting point.
Great. And Daniel as well. Thank you for being here. Where can people contact you?
LinkedIn would be best too for me, Daniel Martz. And it's handled at dmartz, linkedin.com/dmartz.
Awesome. Again, thank you both for your knowledge and for giving us a little bit of insight into designing these voice experiences. This is going to be the norm for the foreseeable future here. So really, really important topic. Thank you both.
Thanks for having me.
All right. Thanks so much.